Hey TRT group, this is Justin again, and today is part 2 in my series of what I've called symptoms of Hashimoto's. So last week I talked about the gastrointestinal manifestations of Hashimoto's as well as the neurologic manifestations. So today I want to talk about how Hashimoto's can have effects on sexual dysfunction, some peripheral neuropathies, and also its implications with vitamin D. So let's get started. So in men with hypothyroidism, it can cause sexual dysfunctions such as erectile dysfunction, delayed ejaculation. It can decrease the man's sperm count. It can also cause low testosterone. Now, it's speculated that hypothyroidism causes delayed ejaculation by a secondary increase in prolactin. Now, I've mentioned this before in a prolactin video, that when prolactin goes up, it can deplete your dopamine, which is responsible for pleasure and reward, in this case, sexual satisfaction. Also, the secondary increase in prolactin can also cause a decrease in testosterone. It's induced hypogonadism. Additionally, hypothyroidism can suppress the gonadotropins. It can reduce the release of FSH and LH, which is responsible for Sertoli cells, which produce sperm, and Leydig cells, which produce testosterone. So that's how it can affect your testosterone levels and your sperm levels as well. Additionally, it can also cause erectile dysfunction. Now, that mechanism of action isn't fully understood, but we do know that hypothyroidism does affect endothelial function of the vasculature. Additionally, it also reduces the production of nitric oxide, which is a potent vasodilator. Next possible manifestation of Hashimoto's and or hypothyroidism, whichever umbrella you want to place it under, interestingly and strangely enough, is, believe it or not, it's carpal tunnel syndrome. And when I say carpal tunnel syndrome, yes, I'm referring to carpal tunnel syndrome that affects the wrist and the median nerves, which typically affects the first 3 digits of the hands. Now, the underlying pathophysiology of how this occurs is that hypothyroidism leads to an infiltration and accumulation of mucopolysaccharides within the tendons, on the tendons and within the synovial sheaths. This also can occur, or should I say that Hashimoto's can also lead to peripheral neuropathies, again with the same underlying pathophysiology. It affects the tendons and the synovium. But you can reverse this upon initiation of thyroid hormone replacement therapy. How long it takes to reverse this or mitigate the situation, we don't know. Also, lastly, last part about this is that there's some literature that suggests, or actually says now, if you have a patient that presents with carpal tunnel syndrome and or peripheral neuropathy, you should screen them. You should pull their thyroid panel to rule that out as an underlying etiology. So the last segment in today's video is the relationship between vitamin D status and Hashimoto's. So one of the big overlapping findings in patients with hypothyroidism, and especially those with Hashimoto's, is a vitamin D deficiency. So whether being vitamin D deficient is a predisposing factor to developing Hashimoto's, or having Hashimoto's leads to a vitamin D deficiency, that we don't know. But what the literature has demonstrated is that there is an overwhelming abundance of literature that shows that there's huge correlations between vitamin D deficiencies and Hashimoto's. Also, the literature shows us that patients who have lower vitamin D statuses, they also tend to have higher TSH values, and they also tend to have higher TPO antibody values as well. That's thyroid peroxidase antibodies, which those are present in patients with Hashimoto's. So what I've seen clinically and what I've seen throughout the literature is that if a patient has Hashimoto's and concomitant vitamin D deficiencies, getting their vitamin D optimized will not only increase their, or should I say, they'll augment the patient's quality of life. It'll mitigate the symptomology that they're experiencing, but it'll also reduce their antibody load. So that's all for today. I appreciate y'all tuning in, and the third installment should drop in another week or two. Appreciate y'all.